I've never used a teleprompter before. It's like karaoke except that you follow me instead of I follow you. Okay, I get it. Hello everyone, I'm Dr. Tay Kai Jack, member of Singapore Cancer Society's Prostate Cancer Awareness Committee and Director of Urological Oncology at the Singapore General Hospital. Today, I'm here to answer some commonly asked questions about prostate cancer. Let's see what they are. What exactly is prostate cancer? Well, the prostate is a walnut-sized gland located between the bladder and the penis. It secretes fluid that nourishes and protects sperm and is a vital part of the male reproductive system. Prostate cancer develops when cells in the prostate gland undergo uncontrolled growth and become malignant, forming a lump and invading surrounding tissue such as the seminal vesicles and the bladder neck. Do you know that prostate cancer is now the second most common cancer among men in Singapore? It mainly affects older men. Will I feel a lump if I have prostate cancer? And what are the other signs and symptoms? Prostate cancer often goes unnoticed, as it rarely exhibits any symptoms, especially at stage 1, where the tumours are small and only detectable via resection or biopsy under a microscope. Tumours from stage 2 onwards usually can be felt by a digital rectal examination performed by a doctor. Other signs and symptoms include weak and interrupted urine flow, frequent urination during daytime and at night, blood in the urine and semen, or persistent pain of the lower back. Now, many individuals present with no symptoms, which is why we recommend that men with a family history should get a screening blood test. And do note that these symptoms may be caused by a number of problems and do not necessarily indicate the presence of cancer, so always consult your doctor for advice. Is it true that I do not have to worry about prostate cancer because it is not deadly? Most prostate cancers grow slower than other types of cancers. In some cases, early-stage patients with non-aggressive cancer only require active surveillance, which involves monitoring by blood tests and repeat biopsies. No treatment is needed for such patients. But it is important to note that aggressive prostate cancer, on the other hand, needs to be treated. It can spread to the lymph nodes and bones quickly and may cause severe pain and other complications, even death. Does prostate cancer treatment cause urinary incontinence? Prostate cancer patients have a variety of treatment options based on the stage of their cancer. Urinary incontinence is a possible side effect of some forms of treatment for prostate cancer. However, advances in treatment technology, such as robotics or targeted radiation, have reduced the incidence of these. Now, if the cancerous area is small at the time of detection, it can even be targeted with a needle and destroyed with minimal side effects in a process called focal therapy. I hope that we have cleared some of the doubts and questions that you have today, and please join us at any of our upcoming webinars to learn more. Stay safe and goodbye.
Yeah, you win again lah.
Of course, I always champion one. Hey, you see outside so hot lucky thing we can play inside the RC
Yes, yeah. With this Singapore heat, I think can get skin cancer leh.
Hey, kena cancer don't play liao
Exactly! Cancer is a serious health issue. Skin cancer, breast cancer, lung cancer, so many types of cancer. But is there a specific type of cancer that we tend to overlook? One that only affects men?
Which cancer are you talking about? Cancer.
Not to worry, gentlemen, your prized manhood is safe. But your prostate is not!
Prostate? Semi-prostate.
Well, the prostate is a walnut-sized gland. It is located in front of the rectum and below the bladder. The prostate produces fluid that protects your sperm, which means it is a gland more important than you think. Common symptoms of prostate cancer revolve around urination issues, as urine flows out from the urethra, which runs through the center of the prostate.
But all old men they have problem in peen one.
Well, that's the thing. Interestingly, people with early stage prostate cancer tend not to have any symptoms at all.
Then,
How to know?
If you have prostate cancer, lumps may form in the prostate, which might be felt by a doctor during a digital rectal examination, or DRE. This involves the doctor inserting a gloved, lubricated finger into the rectum. This examination may be mildly uncomfortable, but isn't painful and only takes a short time. However, the chances of prostate cancers being detected during a DRE is low. Therefore, prostate-specific antigen or PSA blood test is also done. Any abnormalities would then need to be confirmed by a prostate biopsy.
we are safe
Walao, the guy siao
scared us for what?
Because, gentlemen, the number of local men afflicted with prostate cancer is rising rapidly. Thanks. It now makes up 1 out of 7 cancers in men here, and it is now also the 3rd most common cancer in men. That's up 4 ranks. From 40 years ago, it was 7th then.
This kind of cancer only kena the old. We only turning the 50, right?
Really? Wow, it's good that you're still so young. While an average of 6 out of 10 diagnosed prostate cancer patients are men aged 65 or older, that makes about 40% of them younger than 65. Men in their 50s should consider discussing with their doctors if they should be tested for prostate cancer. If the cancer is detected earlier, the cancer is more likely to get a better treatment outcome.
I'm the lucky one. My father, my grandfather all don't have cancer. I confirm and chop. I don't have cancer. All good. No worry.
Well, while family history is a risk factor for prostate cancer, only about 5 to 10% of all prostate cancers diagnosed are passed down from family members. When it comes down to it, the cause of prostate cancer is not known. Factors such as environment have been shown to influence genes. So, while the men in your family might be lucky enough not to have prostate cancer, you might not be so lucky. Touch wood.
Then what's the point? If you kena cancer, you should die. So, no choice lor.
Prostate cancer can range in aggressiveness. Of those diagnosed with less aggressive prostate cancer, less than 1 in 20 men die from prostate cancer 10 to 15 years later. They might not need any treatment, just surveillance, as they are unlikely to die of the cancer and more likely to die with the cancer. On the other hand, men diagnosed with more aggressive prostate cancer need early radical treatment to prolong survival. Again, think about it. Do you want a kitten or a lion?
So how? Together we go and see our doctor for the DIE and PSA.
Our Men's Health Fair, jointly organized by Singapore Cancer Society, SCS for short, and Tampines West CC, supported by our partners, National Cancer Centre Singapore, National University Cancer Institute Singapore, National University Hospital, Sengkang General Hospital, Society for Men's Health Singapore, Singapore Urological Association, and Tan Tock Seng Hospital. A quick introduction on SCS for those of you who are new here. Singapore Cancer Society is a social service agency with a mission to minimize cancer and maximize lives through programs. Some of these programs offered include public education, screening, patient care services to cancer patients in need, hospice home care, financial assistance such as cancer treatment subsidies, and rehabilitation support programs. Apart from the series of insightful talks that you will be happening here at the auditorium from 10 a.m. to 12 noon, there will be many exciting activities at the various booths at level 1. So don't forget to go to the booth at level 1, okay? Where you can participate in games and activities, and at the same time learn more about the cancer screening initiatives and patient programs offered by SCS and our partners. Okay, so for our men who are here today, don't forget to pick up the copy of the International Prostate Symptom Score, IPSS for short, calculator form at the registration counter to identify and assess if you have any urological symptoms that should be highlighted to your doctor for further observations or screening. Do note that the IPSS form provided is not a diagnostic tool, but a guiding questionnaire to identify if you have ever further conversations with your urologist or family physicians. Regardless of the score, you should always consult a doctor if you have any signs or symptoms that you are worried about. Before the end of today, we will be having a follow-along resistance band exercise led by SCS' very own cancer exercise trainer. So stay till the end to receive a free TheraBand for the exercise session. We would also like to take this opportunity to thank our event sponsors, AstraZeneca, Astellas, Bayer, Janssen, as well as our in-kind sponsor, Metro, Monaco, and True Fitness for their support. Lastly, to avoid any disruptions during the talk, please be reminded to turn off your handphones or switch them to silent mode. If you require any assistance, do approach our friendly staff from SCS at the back of the hall. Can I get the SCS staff to wave? They'll be at the back of the hall, okay? Okay, so our guest of honor, Mr. Masagos Zulkifli, Minister of Social and Family Development, Second Minister of Health, Minister in charge of Muslim Affairs, as well as the advisor to Tampines GRO, will be arriving shortly. So just take a seat and relax. Guest of honor, Mr. Masagos Zulkifli, Minister of Social and Family Development, Second Minister of Health, Minister in charge of Muslim Affairs, as well as the advisor to Tampines GROs. In his entourage, we have SCS Chairman Mr. Lee Meng Tat, SCS CEO Mr. Albert Cheng, SCS COO Ms. Geraldine Lim, and Chairperson of SCS Prostate Cancer Awareness Month Committee, Dr. Jeffrey Tuan. Let's put our hands together to welcome them. May we invite our distinguished guests to take their seats. And firstly, may I also invite SCS Chairman Mr. Lee Ming Tat to come on stage to give a welcome address. Mr. Lee, please.
Minister Masako Zulkifli, Minister for Social and Family Development and Second Minister for Health, Minister in charge of Muslim Affairs and advisor to Tampines grassroots organizations. Mr. Albert Chin, Chief Executive Officer of Singapore Cancer Society, our partners from Singapore Urological Association, Society for Men's Health Singapore, National Cancer Centre Singapore, and National University Cancer Institute Singapore. Ladies and gentlemen, good morning. Thank you very much for joining us at the inaugural Men's Health Fair hosted by the Singapore Cancer Society. After successfully organizing 5 virtual editions of the Prostate Cancer Awareness Campaign, we are now moving it into a physical event as part of the Men's Health Fair. Our primary goal is to foster awareness and empower men to proactively look after their prostate health while also learning more about the prevalent urological issues associated with aging. For the past 59 years, the Singapore Cancer Society, SCS, has been at the forefront of the battle against cancer, leading the charge to reduce cancer incidence, increase survival rates, improve quality of life, and foster greater community action in support of those affected by cancer. Our comprehensive range of care services encompasses various stages of the cancer journey, including preventive measures through public education campaigns and screenings, patient support services such as psychosocial support, rehabilitation programs and welfare services, and palliative care. The incidence of prostate cancer has been steadily increasing over the years, and SCS has been working on dedicated programs to increase awareness of prostate cancer. In 2022 alone, SCS community health and outreach efforts reached out to over 1,000 members of the public to raise awareness for prostate cancer and to encourage men to be aware of the signs and symptoms. Over the years, we have made substantial progress in our initiatives to offer comprehensive support for prostate cancer patients. In 2018, SCS started the SCS Prostate Cancer Specialist Nursing Program. This program serves as a collaborative effort with partners from SGH, NUH, and Tan Tock Seng Hospital, aiming to empower and train prostate cancer specialist nurses. These dedicated professionals play a pivotal role in delivering the full continuum of care to prostate cancer patients within their respective healthcare settings. The objective of the program is to establish a holistic model of care for patients, ensuring their comprehensive well-being by equipping them with the necessary resources. This approach is designed to guarantee and enhance the timely delivery of optimum care. As part of our initiatives to improve quality of life, SCS Cancer Rehabilitation Center and psychosocial services aim to help cancer patients and survivors overcome the many physical, psychosocial, and emotional challenges which comes with the disease and their treatment. We have noted that 80% of prostate cancer patients aged 60 and older who have visited SCS Cancer Rehabilitation Center have reported struggling with prevalent cancer-related side effects. These challenges include fatigue, deconditioning, pain, weight gain, and changes in emotional and sexual well-being. To address these concerns, SCS collaborates closely with our affiliated hospital to ensure that more cancer patients can access and secure suitable rehabilitation programs at an early stage. To support their recovery journey, SCS offers the Return to Role and Return to Work programs designed to assist cancer patients and survivors in managing their side effects and transitioning back to normalcy. These programs include physiotherapy sessions and cancer exercise therapy, like aerobic muscular strengthening, flexibility, balance, and weight-bearing exercises. In addition to rehabilitation, SCS also focuses on the mental health of cancer patients. The cancer journey is a mentally taxing one, and hence, cancer patients require an extensive support system that extends beyond their family, friends, and doctors. SCS administers one of the highly effective prostate cancer support group initiative known as the SCS Walnut Warriors. Today, you will have the opportunity to listen to the current chairman of Walnut Warriors, Mr. Sam Ho, as he shares valuable insights during his talk. Since its establishment in 2015, this program has attracted nearly 300 members. Its core mission revolves around providing a supportive environment for men affected by prostate cancer, enabling them to openly discuss their journeys, exchange information, and gain valuable perspectives on how others have managed their condition and the challenges they have faced. In addition to the peer-and-peer support system in the group, educational talks are also organized for the members to learn more about prostate cancer-related topics, such as treatment options and side effects, through talks by doctors and other health professionals. The members also engage in the Walnut Warriors exercise program, which is a 12-session weekly exercise consisting of low-intensity, resistant band workout to strengthen overall health. The strong fellowship and community spirit play a pivotal role in helping cancer patients and survivors to overcome what may be one of the most daunting challenges they face in their lives. Nevertheless, prevention and early detection remain of utmost importance. That's why we host events like this today to educate the public about the common signs and symptoms that men should remain vigilant about, and if needed, communicate to their doctors. I strongly encourage you to take note of the valuable insights shared by our medical professionals during today's sessions. Let's all keep in mind that early detection through regular screening can lead to improved health outcomes and a better quality of life. Thank you.
Thank you, Mr. Lee. It is truly important for us to be on top of our health, and events like this really help us in finding out more about health conditions we may not know. Next, may we invite our guest of honor, Mr. Masagos Zulkifli, Minister of Social and Family Development, Second Minister for Health, Minister in charge of Muslim Affairs, as well as advisor to Tampines GROs, on stage to give an opening address for today's event.
Mr. Lee Meng Tat, Chairman of Singapore Cancer Society, Mr. Albert Ching, CEO of Singapore Cancer Society, colleagues, ladies and gentlemen, welcome to Tampines West CC. I'm very happy to see so many of you this morning. It's barely 10 o'clock. Most of us right now should be at a coffee shop enjoying our weekend with our family. But I see many men have turned up to this morning, and it's a good sign that we care about our health. Today is Singapore Cancer Society first Men's Health Fair. And the Singapore Cancer Society has since 1964 been at the forefront to raise awareness, to provide support for cancer patients and their families. This is a very important organization. Not only are they almost as old as Singapore, but also have been journeying with Singapore. As you have mentioned just now, the discovery of cancer among men and women has been on an increase in Singapore. But don't worry, it's not because we all suddenly have more cancer incidents. It's just because we are doing the right thing. We go to get screening, we discover early. And when you discover early, the cure is highly, highly possible in today's technology. So don't be frightened about discovering. Find out, go to your GP, go to your specialist. And in Singapore, don't worry, even you think the treatment may be expensive, go first, then appeal for the payment later. Most payment will be waived, don't worry. Except for Masagos, so Masagos should not get it waived, right? Yeah. Now, the Singapore Cancer Registry 2021 23 cases every day. 23 cases every day. 4 of these are prostate cancer. So out of 23, 4 are prostate cancer, and now is the most common cancer among males. From 2017 to 2021, that means about, in total, you added up about 7,000 cases. But on a positive note, the first-year survival rate for prostate cancer close to 90%. Like I mentioned just now, discover early, you will most likely going to recover. In the early stage, however, prostate cancer has no signs, no symptoms. You do not know, very silent. And then the advanced prostate cancer causes other symptoms like difficulty to pass urine, even blood in the urine. Many have mistaken these to be benign urological issue. I mean, like growing old, it's normal. Hence, they are aware of the signs, they see the sign, they see the symptom of prostate cancer, but many do not take action. So they wait and wait and wait until pain comes. But please don't do this. Go see your doctor. Approach your doctor, get advice. Earlier I spoke to SCS with the need for more community-focused initiative to make sure that men understand, are aware about this problem. What the symptoms are of prostate cancer, what the signs are, and have a discussion with your doctor. And maybe today, because I also come from Ministry of Health, I like to encourage all those with white hair like me, If you have not already signed up for Healthier SG, please do. Please do. Now, some of us don't misunderstand Healthier SG because they think that for some who are already seeing specialist doctors, why must you sign for Healthier SG? There's a difference. There's a difference. Specialist doctors are here. Specialists are narrow in their specialization. If you have cancer, they know about your cancer. But there may be other things about you that you need to know, and GPs are the best people to do this. And you cannot do this over one visit. You have to get the familiarity of the GP to understand your family history, how you have been growing up, so they know you well, and then they give you a more holistic diagnostics of you. The second other difference between Healthier SG and what we do today is you go and see your doctor before you are sick. Whereas today we see the doctor to get an MC, correct? You go and MC because you get a flu, it's quite useless because the doctor cannot cure flu. Whatever the doctor give you, you can buy from the pharmacy, Panadol and everything. You just go home and rest. But many of us see the doctor for the MC. But today, Healthier SG has shifted it to see the doctor so that the doctor know you early, faster, and issues like this, prostate cancer, for example, before you even think about the possibility, knowing your history, your family history, the doctor can say, why not go and check it out? In fact, this is one reason, if I understand, our Prime Minister, Mr. Lee Hsien Loong, discovered very early and very quickly cured totally. Because we discover early stage of cancer, almost like a flu, can be managed and can be cured. And therefore, one of the things that we can talk about prevention, and we can see the doctor regularly, someone who knows you, is to give you a very good advice on how to manage our lives. Among others, even for prostate cancer, a healthy diet and regular exercise. Quite simple, but what kind of exercise and what kind of diet? And please, I think doctors here can testify to me, don't think supplements can solve it. So many of us go and buy supplements, spend a lot of money, buy vitamin B, vitamin A, and you see the label can prevent prostate cancer. Please don't self-medicate. Please see a doctor. We have the best health system in the world. Don't go to the pharmacy and make them richer just buying all these tablets and feeling good about it, because the doctors know what you need, not the people who sell you the supplements. So take this opportunity to learn something useful, what you can even do at home. And if there are things that you want to do in the CC together, doing exercises, organized, we will help you do it. Because some people like to do it alone, some people like to do it in a group. We will support you. And there are also virtual resources on your phone. You have nothing to do waiting for the bus. Go and read them. And I hope they're also in other languages. Are they also in Mandarin? Yes, they're also in Mandarin. So you can read them if you don't understand English. Therefore, as I mentioned just now, prevention, early detection are key in taking care of ourselves where cancer is concerned. Particularly if you have a history in your family. Go and get checked up early. Don't worry about costs, because if in Singapore you can't afford, there are ways for the government to support you. In closing, again, let me thank Singapore Cancer Society for putting this together in the community so that you don't go out there to find out about what the issues are. They have come here. So if you are here also and you think your friends can benefit, this exhibition and awareness will be until whole day. It's a whole day in the afternoon, so call them down, tell them it's very nearby. After that, can go for your coffee or for your lunch around the N8 coffee shop. There are 7 good coffee shops around here, you can enjoy them. In the meantime, again, thank you for coming on this Sunday, and very good to see you all again. Use the knowledge, find out more, share the knowledge, encourage people to do the right thing. Prevent, detect, get treatment. Thank you very much.
Thank you, Minister. Can we kindly have you remain on stage as we invite Mr. Lee Ming Tat back up to present a token of appreciation for your generous support for our cause and for the cancer community. Mr. Lee, please. This token, titled "The Sun Will Always Shine," is painted by a cancer warrior, Ms. Ao Yong Ying Ling, who is also a member of SCS's Reach to Recovery Breast Cancer Support Group and a SCS enrichment trainer. Through this artwork, she hopes to share her message that life is full of ups and downs. Even in difficult times, it is important to remember that things can and often do better. By staying positive, working towards our goals, and supporting each other, we can create a better future for ourselves and those around us. Always remember, the sun will always rise, and tomorrow will be a better day. May we now also welcome SCS CEO Mr. Albert Ching, COO Ms. Geraldine Lim, and Chairpersons of SCS Prostate Cancer Awareness Month Committee, Dr. Jeffrey Tuan, on stage for a photo together. Thank you. Now, can we also have our event speakers up on stage for a group photo? That includes Dr. Daniel, Dr. Raj, Dr. Joe, Mr. Sam, Ms. Vijaya, and Ms. Michelle, please. Thank you, and you may take your seat, except for Dr. Daniel, who is our first speaker of today. We will now commence our series of insightful talks for today. First up, we would like to introduce Dr. Daniel Yong, Assistant Head and Consultant of the Urology Department in Tan Tock Seng Hospital. He is also a committee member of the SCS Prostate Cancer Survivorship Program's Advisory Panel. Dr. Daniel's current interest is the field of urology is robotics, minimally invasive surgeries, and uro-oncology. Today, He will be sharing the signs, symptoms of prostate cancer, which leads to the question if you should be worried about prostate cancer. Dr. Daniel, please.
Hi, good morning, Minister. Good morning, SCS leadership. Good morning, distinguished guests in our audience. Thank you for taking time to listen to my talk. I'm actually very heartened to see such a good turnout. SCS has definitely done a good job in bringing about prostate cancer awareness. Prostate cancer is not unlike other cancers. Prevention, early detection is actually the key to management of survivability. So my topic is, should I be worried about prostate cancer? Probably all the men in the audience actually should have this question. You should ask yourself that. Not really for the ladies. Okay, the truth is actually some ladies might have thought that they have a prostate. That is true. I mean, some of my friends actually asked me that. So in this talk, I hope that I can give you all the education and then you all can know better. So just a bit of basic, if you pay attention to the talks earlier, what is actually the prostate? It's actually not, some of us men actually thought that it's our balls or our testes. That's not true. It's actually a gland below our bladder. It actually produces fluid for our semen. So you can see in this picture, it's actually just below the bladder there. And also, one thing is that it differs from BPH. Some of us think that benign prostatic enlargement is associated with prostate cancer. That is not. It's actually a different disease. Okay, so more recently, prostate cancer has actually overtaken colon cancer, lung cancer as the top cancer in Singapore. But fortunately, it's actually not the highest cause of mortality in terms of cancer. I think this actually is partly to do with our screening, and that actually Singapore Cancer Society has done a good job in bringing about cancer awareness, and our Ministry of Health has also brought about screening. Therefore, that's why we can detect prostate cancer at a higher rate, more importantly at the early time. So just a bit more about the natural history of prostate cancer. Do we actually have to be worried about it? Well, actually, we should at least question ourselves about it. But even if it happened, we don't have to worry that much because in terms of mortality, it's not that bad in comparison. So if detected early, survival is actually very good. It's almost close to 100% that we will actually have a 5-year survival of prostate cancer. Okay, this is the caveat that it's been detected early and treated accordingly. Okay, but this, when we think about late-stage prostate cancer, then of course, survivability becomes quite low. In fact, it's less than 40%. I'm sorry about that there. But even then, because of the advancement of medical health, and in Singapore, we actually have the latest medicine, that's why we can actually help to prolong life, not just prolonging life, but having a good quality of life for prostate cancers in Singapore. So I think this is probably the slide that probably interests our audience most. What are the risk factors for prostate cancer? There is some familiar history, although of course that will require direct relatives like our father or brothers to have prostate cancer. So sometimes that you might not have family history, but that does not mean you might not have prostate cancer. The other thing is also genetic mutation. What we see is BRCA1, BRCA2, ATN, and this usually leads to what we call more advanced prostate cancer. And of course, ethnicity also affects African Americans. The other things that we can actually correct is to prevent diabetes and obesity. So having a healthy lifestyle, exercise, watching our diet, that's actually very important in preventing prostate cancer. Of course, to cease smoking if you do, and not to take up smoking. So I think the other ones that we want to do is to think about that we can actually manage is our diet. Right? So some of the evidence, they are not strong, but it's something that we can do without much risk, and so why not? One of the things is to cut down alcohol. Although they have found that abstinence actually leads to a higher risk of prostate cancer. So perhaps maybe just an occasional glass, a social setting, that actually is fine. And in coffee actually has seemed to a certain extent to have decreased the risk of prostate cancer. But the caveat is, like I mentioned, the evidence is not strong, but there is some evidence to it. Fresh tomatoes is also found to decrease the risk of prostate cancer. Meat has been found to increase our risk. So maybe not too much meat, healthy diet, balance it with tomatoes, fruits. That would be what I would actually advise most of my patients and my family. Okay, and soy also has been found to possibly decrease cancer. although it might lead to an increased detection of more aggressive prostate cancer. And I think like Minister has mentioned, not all vitamins are good. Right? So too much or too low of vitamin D can actually increase your risk of prostate cancer. Likewise, vitamin E and selenium. Prolonged exposure can lead to an increase of prostate cancer. So by and large, stick to a healthy diet, have a healthy lifestyle, exercise, and actually you'll be on the right path to preventing prostate cancer. And do have your conversation with your doctor, you have a chance, whether is it your general practitioner or a doctor friend. So going more a bit about into what PSA is. So PSA is what we do have at this moment in terms of screening for prostate cancer. So PSA actually is a blood test, it's prostatic specific antigen. So that is what we do have commonly, and that's what we do for screening. So I think in the past, before 2012, actually that was a recommendation that everyone should get PSA screening. So what they found was that they led to actually perhaps over biopsy, over treatment, and that could be unnecessary. And that led to, instead, in 2013, the recommendation then was for non-selective screening. But unfortunately, that led to the detection of more aggressive cancers. And that's why in 2017, things have been revised. And this is something that we still kind of hold true to today, which actually is opportunistic screening. So what that means is that if you do happen to go to your doctor, whether it's a GP or a urologist, then there should be a conversation about whether PSA screening will benefit you, whether should we do it, and be prepared for what happens next if it is elevated. So in Singapore, our Singapore Urological Association, we actually follow quite closely the international guidelines, in particular the EAU guidelines. So this is what actually we do recommend in terms of screening. If you're more than 50, do consider screening. More than 45 if you have a family history. And of course, if you do happen to be aware of BRCA mutations, then that is where you need to do your screening much earlier. And with regard to screening, we also usually only do that if you have an expected life expectancy of more than 10 years at least, because or else you may not actually benefit from the treatment of prostate cancer. So that's a ballpark figure. I mean, nowadays our life expectancy is quite far. So actually we can do screening all the way up to 80 years old, because most of us men actually probably expect to live up to 90, maybe even further as time comes along, because we do have excellent healthcare. And in Singapore, quite commonly, PSA is part of our health screening package. So a question that even I do ask myself, should I do a PSA test? So there is some caveats to it. Early screening and diagnosis is important, but screening does not actually lower your risk of cancer. Normal PSA also does not guarantee cancer-free. In fact, that's actually not a true, real, normal kind of PSA. A high PSA does not also necessarily mean that you have prostate cancer. And that's also the risk of overtreating. What happens if you do have elevated PSA? Prostate cancer usually does not have symptoms. But the fact is that if it does, very likely you have advanced prostate cancer. It has already invaded, caused obstructive urinary symptoms, or worse, even bone pain. So that actually comes too late. Therefore, we actually encourage, if you can, to speak to your doctors early. So like I mentioned, there's no true cutoff for elevated PSA, but what we do use as a working diagnosis, in the past it used to be more than 4, now it's more than 3. So what happens if there is something between 3 and 10, then we might do some further testing or imaging. Okay. So causes, like I mentioned, the PSA is not just caused by cancer. It can be caused by benign prostatic hyperplasia, can be caused by urine infection, and even trauma or stimulation to the prostate can cause an increased PSA. And when we have elevated PSA, we also look at what we call adjuncts, additional things to give us an idea of whether should we biopsy our patient, whether is it something that really signifies cancer. So things like density, PSA density, free total, velocity, how it goes through time, and of course prostate health index. Okay. And more commonly now in this modern day in Singapore, what we do have widely available is MRI, magnetic resonance imaging of the prostate. Because like I mentioned, when we have what we call low-risk prostate cancer, you might not need treatment. So MRI actually helps to detect what we call clinically significant disease, which means that prostate cancer that should be treated, that we want to detect and treat you early. Okay. So what is the patient journey? So if you do have an elevated PSA, most of the centers in Singapore we actually recommend you to go for a magnetic resonance imaging of your prostate. And from there, if there are any suspicious lesion, we will actually do a biopsy. And from this biopsy, that's where we will detect cancer. So more commonly nowadays, we do the biopsy transperineal. You can imagine in the past, the needle actually used to go through the rectum. It's quite painful, higher risk of infection. But now we have brought down infection rates. So it's not just infection, pain also I find that is also more comfortable. And my patients are actually more willing to go through transperineal biopsy. So if you have a biopsy result, and unfortunately that you might have prostate cancer, so these are the things that your doctor will actually go through with you. So what do I mean by low risk of spread? Whether is it to your lymph nodes or to the rest of your body and eventually causing death. So this one depends on the pathology of your prostate cancer. So if you do have low risk, then we can actually watch and wait. We watch and then, but if it does show signs of upgrading or upstaging, that's when you need treatment. So you have intermediate and low risk, intermediate and high risk, that's when you might qualify for surgery or radiotherapy. I think some of my colleagues later on will share more about that in terms of treatment. So for local disease, like I mentioned, low risk, we can do active surveillance, and we wait to see if it becomes more aggressive, and that's where we do radical treatment. Radical treatment will be either radiotherapy or actually removal of the prostate. So in Singapore, surgical-wise, our centers, usually what we do is called robot-assisted laparoscopic prostatectomy, because it's not just good enough to treat your cancer, we also want to have good functional outcomes for you in terms of your continence and also erectile function. So some of us may reach this stage where we are actually diagnosed with prostate cancer. Being diagnosed with prostate cancer can be quite devastating. It can be quite difficult on our emotions. So that's where actually psychosocial support is very important. And I'm fortunate that Tan Toh Seng, we have actually partnered with the Singapore Cancer Society. We've come with this specialist nurse program. Because sometimes your doctor sees you only maybe for less than 20 minutes. That might not be enough to give you the social support. And that's where our nurses actually come in. They're very good. They give you the social support. Not just that, they also will give you other links and other information where you can get and find them. So right now, I think there are 32 nurses trained nationally. And of course, Sister Sarah works closely with me. I think she's one of the pioneers. And at Tan Toh Seng alone, we see about 120 new prostate cancer patients. And all of them will at least have gone through some counseling, some psychosocial support with Nurse Sarah. And at Tan Toh Seng, besides that, we also have our support groups. Of course, this is some links to, of course, the Walnut Warriors. At our place, we call them Walnut Avengers. They're actually part of the Walnut Warriors, actually. So just a couple of pictures. This is how we have our meeting. So this is where, if any of the patients have any questions, they can ask me. But more importantly, actually, it's not about asking me. It's about asking their fellow patients, prostate cancer patients, what they went through, what to expect. And that's probably the most important source of information. And just recently, we actually celebrated our 12th anniversary. Yep. So with that, what I can say is that if, unfortunately, you do have prostate cancer, do not worry, because you will be very treated with the best health care that we have in Singapore. Thank you very much.
Thank you, Dr. Daniel, for the insightful sharing and also educating us on how technology has come leaps and bounds in helping screening and curing the disease. Before we move on to the next topic, we would like to take a minute to thank Minister Masagos for gracing our event today as he takes his leave for a short tour of our interactive booths downstairs. Let us put together our hands to thank Minister Masagos for his kind support. Okay, so now back to the learning. We will also have a combined Q&A session later in the segment, so we appreciate if everyone can hold on to their questions till then. Next up, we would like to invite Dr. Raj Tiwari, who is currently serving as a consultant urologist at Sengkang General Hospital and National Cancer Centre Singapore, up on stage. Dr. Raj's subspecialty interest includes urological cancers, and today he will be sharing if prostate cancer can be treated without surgery. Let's welcome Dr. Raj.
Hi. Hello. Hi, everybody. Good morning. Really nice to see such a great turnout in the morning. And we really appreciate Singapore Cancer Society for organizing this and inviting us to come and speak to you. Sengkang General Hospital is one of the newer hospitals in Singapore, but the doctors are not all new and inexperienced. We've actually been trained in other hospitals, and some of us even gone overseas for several years to train and in multiple different disciplines. So today I will be speaking to you about the non-surgical treatments available in prostate cancer. The message I want to give you is that there's been an explosion in the amount of treatments available for prostate cancer, whether very early on in the disease or very late on in the disease. And just because you have advanced prostate cancer, it's not a so-called death sentence. There's lots of options available to help patients who are in this stage. So just want to go through with this. So as Daniel has mentioned, prostate cancer is actually now the #1 cancer in men in Singapore. It has been a #1 cancer in men all around the world, especially the Western world, for a long time. And now it's slowly coming to our shores. Is it because that suddenly prostate cancer become common? No, it's because we are picking it up more and more as more and more men come forward. But the mortality is low, which means that we are treating the cancers well. So despite it being #1 in incidence, the death rate is lower because the treatment is good. In general, prostate cancer is understood in different disease states. It's either low risk, intermediate risk, or high risk, which is localized to the prostate, that means never spread, or it is spread, which is metastatic. And when it's metastatic, it can be sensitive to hormones, which is how we treat it, or the cancer becomes very naughty. With time, it evolves a way to evade the hormone treatment, and then it becomes what we call castrate resistant. That is the most aggressive form of prostate cancer. Broadly speaking, there are different treatment options for different stages of cancer. Every cancer can be treated differently. For the early stage of cancer, it's either to surveil, meaning to observe the patient in a protocol, to radiate. Intermediate patients can be treated through surgery or radiation, and the high-risk patients need a combination of different treatments added on, like a kueh lapis. No, you add on one onto the other to kill off the cancer, be it surgery plus radiation or radiation plus hormones. And the metastatic, which is the advanced case, can be treated in many different ways. You see, the metastatic actually has the most wide range of treatment options, meaning that there is always hope in prostate cancer. Active surveillance is commonly being used now in early stage prostate cancers. Does it mean that you just monitor the patient and that's it? No, it's actually far more complex than that. You basically are doing regular tests, regular checkup, blood tests, MRI scan and biopsy for this patient over a prolonged period of time. And evidence has showed us in large series of patients that for the low-risk prostate cancer, it really doesn't spread and it really doesn't grow. So there's no need to subject a patient to invasive surgery, radiation, and cause them all kind of side effect, all kind of trouble, all kind of cost and financial difficulty unnecessarily. The low-risk cancers can be observed very safely. As part of my training, after I finished being a urologist, I went to Toronto, Canada for 2 years, and I further subspecialized in cancers of urology. I spent a long time there learning from the masters and the KPI, the key opinion leaders on these treatments. And Dr. Lawrence Klotz is the #1 urologist for active surveillance in the world, I would say. So I got a chance to learn from him also while I was there. 1% of these patients with low-risk prostate cancer will spread after 10 years. 99% don't. So the low-risk patients don't really even need any aggressive treatment, but they do need close monitoring. Patients are generally very happy with active surveillance compared to the other treatments because it's not causing them major side effects. Apart from active surveillance, and of course the other options which Dr. Daniel have mentioned to you, which is robotic surgery, focal therapy is something that's coming up now. You don't have to take the whole prostate out. You just do a targeted treatment to where the tumor is. And currently we are running some of these different focal therapy options under clinical trials in our hospitals, where you either freeze the cancer with cryotherapy or you burn the cancer with HIFU. HIFU means high-intensity focused ultrasound. Or you use laser to burn the tumor. So you focus the treatment to treat the cancer only and spare the rest of the prostate and the area around the prostate. But to be very honest with you, it's not reached mainstream yet because it's still under clinical trial. But so far, it's been run for at least 5 years, and the results are very promising. And it's definitely something that's here to stay. Over the next few years, we'll see more and more patients going for it. Cryotherapy, as I mentioned to you, is about freezing the cancer. Basically, needles are inserted into the prostate under guidance. The patient is under anesthesia. The needles create an ice ball that is up to minus 40 degrees Celsius. This freezes the prostate cancer. At the same time, there are warming catheters placed to protect the area around the prostate so that that part of the prostate is not damaged at all. And the patient have good continence, good potency at the end of this procedure. Far better than taking out your prostate. The other big treatment option for prostate cancer that is not surgical is radiation. And for your information, radiation treatment and surgical treatment are equivalent in outcomes for prostate cancer. It's not that surgery is better or radiation is worse. Radiation, there are different types. There's external beam where you shine radiation to the prostate from the outside, or internal radiation, which what we call brachytherapy. And finally, proton beam therapy, which sounds very fancy and is coming into NCC now, National Cancer Center. We'll talk a bit more. External beam radiation, very simply, is using radiation to shine the prostate over several sessions. It may be combined with hormone treatment, and there are some common side effects like incontinence, erectile dysfunction, blood in the urine or in the stools. Of course, the rate of incontinence with radiation is far lesser than with surgery. The rate of incontinence with surgery can be almost 80% immediately after surgery, down to 10% 12 months after surgery, while in radiation, the rates are far lower. Brachytherapy is a form of internal radiation. There are two types of brachytherapy, the low dose rate and the high dose rate. The low dose rate is basically here on the left, where you actually are putting seeds into the prostate that are radiated, and then these seeds give off radiation over a period of time to kill off the cancer cell, and these seeds are permanently implanted. High dose rate on the right side is where you insert needles into the prostate that give a radiation of a far higher dose, and then these wires are being removed after 1 day to reduce radiation exposure in the longer term to the patient. Proton beam therapy is something new. The proton is part of the atom. It's actually in the nucleus of the atom. And this is a newer treatment of prostate cancer. It's being used to essentially use a proton to kill off the cancer cells. But for the proton therapy to work, you need a large machine. And the proton machine is now currently being set up in National Cancer Center. It requires an accelerator to accelerate the proton to the speed that's required for treatment. And they're planning to start it actually next year in the National Cancer Center. So it's something very exciting on the horizon. So I think just to mention, you can see at a different disease state, there's so many different options available. So far, what we've spoken about is localized and maybe a bit on locally advanced. But we will soon talk about the advanced and the metastatic cancer. Is there any hope for the patient who have advanced cancer? So advanced cancer or metastatic cancer basically means cancer that has spread from the prostate to other parts of the body, either the bones or the lymph nodes. And the aim of treatment, unfortunately, in these cancers is control rather than cure. But just because I say control, it doesn't mean that what you see in the movies with advanced cancer, the patient doesn't have much to live and the patient is in a bad state. That's not true. Many of our patients with advanced cancer live relatively happy, long, and well lives under control and with good satisfaction because the treatments allow them to do that, provided they are picked up early enough. So one of the treatments for controlling the patient with advanced prostate cancer is to cut off the testosterone supply. Testosterone is a male hormone that drives prostate cancer like fuel in a fire. So one of the ways of doing this is to remove the patient's testicle to reduce the hormone level. This is only done in men who have advanced or metastatic prostate cancer. Of course, apart from removing the testicles surgically, you can always give medication to do the same thing. The medications are given regularly through injections every few months to suppress the testosterone so that the cancer in the patient is under control. Of course, with anything that we do, there are some risks. And the hormone treatment itself will have some risks. The patient loses muscle mass. The patient can gain fat mass. The sex drive will go down. Some patient can lose bone mass. So there are some issues. But is it really the end? The answer is it's not the end, because we partner with our patients to help them when they are in this stage. We have men plans. We have exercise program. We have dietitian support. We have regular monitoring of their bone health. We give them calcium supplement. We try to help them overcome the side effect so as to preserve a good quality of life while they're on this treatment. Bone protection, as I mentioned to you, is key for men who are on hormone treatment to prevent these fractures. Apart from the first-line hormone treatment, there are many more advanced hormone treatments that are out there. And these advanced hormone treatments help to bring down the testosterone to an even lower level. More and more clinical trials have showed that we should give the patient at least the first line plus the second line, literally bringing a very aggressive treatment to these men with advanced cancer early in their treatment, so as to give them the best possible outcome. Now, of course, in the past, cost is a major issue for these men, because on top of the injection, now you need to take one of these fancy drugs every day. But these drugs, many of them have come onto the cancer drug list, the CDL, which means that they are becoming more affordable to the patient. And these are drugs that the patient will take for their entire course of their lifespan once they've started. And as our men are growing older, the cost is going up. So MOH has started to bring many of these drugs into the CDL list to make it more affordable. But these drugs are life-saving. They give our patients a lot more lifespan when they reach the advanced stage. Now, the most scary part of prostate cancer, the most advanced part of prostate cancer is hormone resistant. Like the COVID virus that become resistant to vaccine, the cancer cells are also very smart. As you give them hormone treatment to suppress them, some cancer cells become resistant to the hormone treatment. They evolve to become resistant. So what do we do in these men? These men are the more advanced cases. Their lifespan is not so good. It's about 13 months. But even then, we can still do things to help them, and there are many exciting developments now. Chemotherapy is one option for these men to help to suppress the cancer. It's using docetaxel, which is a chemotherapy agent given by the medical oncologist. The other option are genetic related. We spoke briefly about genetics and hereditary prostate cancer. More and more we have found that BRCA gene, BRCA gene, which is associated with breast cancer, is now associated with prostate cancer and advanced prostate cancer. And we have found a way to target these genes. We screen the patient who have castrate-resistant cancer. We find out if they have BRCA mutation. Of course, we let the family know and we screen the family. But we target the BRCA gene with these drugs to eliminate the ability of the cancer cell to repair itself. So the cancer cell cannot, the mechanic is basically taken away, the cancer cell dies. So there are these kind of advanced treatment that's actually available now, even in Singapore, to deal with these kind of cancers. PSMA theranostics is a very, very exciting treatment. It's essentially using a smart bomb. We know that a PSMA PET scan is a detailed scan that looks at the prostate. So what did the doctors do? They combine the scan with a treatment molecule that they attach to the substance that goes to the cancer cell. You see the before and after picture. The one on the left, all these images are a whole body scan. All the red dots are the cancer. After you treat PSMA, you see no more cancer. You can see, this is seeing is believing. This picture made it into the New England Journal of Medicine Picture of the Year. PSMA theranostics is essentially very targeted treatment that is used in men with castrate-resistant cancer to improve their survival, and the outcomes have been great so far. It is used almost routinely in Australia now because PET scans are much more affordable there, but even in Singapore, it's coming, and it's going to be first in clinical trial before routine use. Finally, my last slide, take-home messages. The first thing is that prostate cancer is now #1 in men. This is something we have to know, and it's not going to go away. It's only going up because we are picking up more and more of these cancers. But just because it's #1 does not mean that a lot of patients are going to die from it. It means that we have a chance to pick up patients early and treat them well. There's a wide range of treatment of these men, whether it is surgery, whether it is non-surgery. you must understand that you always have a chance to fight and win against this cancer. It's just about coming to seek help at the right time. Advanced cancer is no longer a death sentence. I showed you so many current treatment and upcoming treatment that we have. Even in the worst state, where the patient only has 13 months, there are these treatments, which I'm sure will increase the lifespan beyond 13 months to far longer. Treatment is more personalized. We are looking at your risk factors. We are looking at your genetics. We are looking at your family history to give you the correct treatment for the correct patient. The same treatment may not be appropriate for a different patient. Every patient is unique. So we have to tailor our treatment to suit our patients. There is always more hope and comfort for our patients. Don't feel that prostate cancer is there to take your life away from your family. It's not. We can always join you and fight this battle, and we will win. We are winning already. You can see the mortality rate is going down. And we will continue winning. Whether it is early, intermediate, or late, or even metastatic, there's no such thing as a death sentence in prostate cancer. So my final message is for all the men, Asian mentality, the men must always be strong. They cannot show their weak side. They cannot come forward. Please come forward and see your doctors. If you feel you are at risk, if you feel you need help with your urinary symptoms, men's health is very, very important and it's a key issue. Sengkang General Hospital and our department have a booth downstairs that we have set up. Please come and visit our booth if you have more questions. Thank you very much for your time.
Thank you, Dr. Raj, and sharing with us on the various treatments available through different levels of diagnosis. We all know that for men, there can be a lot more urological issues apart from prostate cancer, especially as one ages. We will now invite Dr. Joe Lee, Senior Consultant at the Department of Urology at National University Hospital, up on stage to address some of the common urological issues that come with age. Dr. Joe is actively involved in clinical trials, research and innovation projects in the field of urology and men's health. He has special interest in topics related to prostate diseases, urinary stones, male sexual dysfunctions, incontinence, infertility, genital prosthesis, surgery, and reconstruction. Dr. Joe, please.
Thank you very much. Thank you, Singapore Cancer Society, for organizing today's talk. I would also like to thank SCS for involving the Men's Health Society of Singapore, which is a group that promotes awareness and also the level of men's health in Singapore. So I have to thank the previous speakers, Dr. Daniel and Dr. Raj, for sharing so much about the PSA, prostate cancer, and what are the options available to treat them, and really giving confidence to patients who have this condition about how they can fight the disease. Now, I won't be talking much about prostate cancer. In fact, what I'll do is to cover some of the more common urological issues that can affect men as they get older. All right, so I'm going to start off with something very basic. All right, the difference between a man versus a woman. I think this is to help everyone have an idea which areas of health should we be focusing on as a man. All right, simply put, right, there are three separate organs, right, that only men have, right? The penis, both a sexual organ as well as part of the urinary system. Right, the testicle, a reproductive organ, but also the source of where the male hormone, important male hormones like testosterone, is produced, right, to give men an overall health. And also the prostate. Right, the prostate, as Dr. Daniel mentioned, is a sexual organ that only men has. And once you know that there are these three organs, then we start to understand what are the conditions that come together with it as one ages. For the penis, there can be cancers as well, right? There can be foreskin diseases, sexual problems, primarily erectile dysfunction, and also some deformities in the penis can form. In the prostate cancer, as we know, right, there can also be benign prostatic hyperplasia, which is known as prostatic enlargement,
that most commonly comes with age. And also in the testes, there can be cancers, although it's much less common in the elderly, all right, in the older age group, and in men compared to prostate cancer, and also the problem of low testosterone or testosterone deficiency syndrome. So over here, right, on the left, you can see a picture of how the urinary system is from the bladder. All right, down below it is a prostate. There's a nice urinary channel. But as the prostate enlarges, all right, it will start to encroach inwards on the urinary passage. Now, when that happens, naturally there will be a difficulty in some difficulty in urination. And what to page some of the men who have BPH experience, they may find that it's taking the stream of flow is much slower. It takes a longer time to pass urine, and the stream may not be continuous. There can be a flow, then it stops a little bit. You squeeze, it flows a little bit, then it stops a little bit. So this can lead to other symptoms such as hesitancy. It takes a long time to start the urine flow going. They may be dribbling, especially towards the end when there's drops of urine that drops on their toes after they pass urine. They may need to strain to pass urine, and at the end of each episode, they may find that there's still, actually I feel like there's still urine left in my bladder, but somehow I just can't get that part out. They may go to the toilet more often. They may be more urgent. When they need to go, they need to go. If they don't reach the toilet in time, they may start to leak and wet themselves, and also waking up multiple times at night to pass urine. So these are some of the what we call lower urinary tract symptoms that affect men with enlarged prostate. Again, there can be an overlap between these symptoms as well as prostate cancer that exists together with this prostate enlargement. So, of course, diagnosing is important, and there is medications that can be used to treat BPH. All right, different types of medication. Some medications are there to relax the muscles around the prostate to expand the urinary tract, keep it open. All right, some of these medication, what we call the 5-alpha reductase inhibitors, work by blocking the external effect of testosterone in the prostate and leading to a gradual reduction in the size of the prostate to some extent. And also there are medications they are taken on a regular, these are medications taken on a regular basis to treat BPH. However, medication may not always work, especially in situations whereby the prostate obstruction is more severe. The man may find that after taking months or even years of medication, the condition doesn't really get better. In fact, it's slowly getting worse. They find that there's urinary retention. It's very hard to pass urine. And in the worst case scenario, there may be complete blockage of the urinary tract. So it can't pass urine, and they go to the A&E in a severe pain and need a urinary catheter inserted to relieve the pain. For this group of patients, surgery is one option. Conventionally, we've been doing a surgery to trim off the prostate using maybe a loop, electric loop. We call it a TURP, what you can see at the left side of the bottom left part of the image. There are also new therapies. I'll just name some of them. One of them is using vapor or steam to heat up the prostate, leading to a slow, gradual decrease in size of the prostate, called the resume, on the right upper part of the surgery image. And then at the bottom, you can see there's also other treatments such as what we call Urolift, which includes the putting in of little implants to push the prostate away and hence increase the size of the width of the urinary passage. Now that aside, testicular cancer is can occur in younger men. All right, it is not a common cancer, but it's important to be aware of its presence simply because we are men. So testicular cancer are usually picked up by the feeling of a lump in the testes, something hard, something not quite right. When there are two testes, you feel one testis compared to the other is not quite the same, right? It may be a sign that there's a testicular lump. When you see your doctor, consult them, most often they will arrange for an ultrasound to be done to check the testes and identify any possibility of a testicular cancer. Some blood tests can be done to look for tumor markers of the testicular cancer. If indeed it is present, then the procedures such as removal of testes by surgery or what we call orchidectomy can be performed. Now, what can we do? All right, this is something I think most men should pay attention to, which is a regular examination, self-examination of the testicles. Right, can do it when you are having a shower. Right, do it once every 2 weeks, once a month. Just make sure you check your testicle. Do it with both hands. One hand to stabilize the testes, the other hand to feel around. It is very much the same as how women are asked to do self-examination of the breast to pick up breast lumps. Also, men should do the same for the testicles. If any unusual lumps are detected and it's getting bigger, gradually it's getting bigger, please pay attention to that and see your doctor for more advice. Now, as I said, the testosterone has another role, which is to produce the hormones for the male. Right, so in this case, I'm just using some funny photos to show you how as one ages, as testosterone goes down, all right, how we start to put on more fat, look a little bit more different. Now, this is common in the aging male. It is common in the aging male, and it can occur at different rate in individuals. All right, so you have some men who are older but still in very good shape because their testosterone levels are still quite normal. Then you have men who show symptoms of low testosterone. What are some of these symptoms? There can be sexual symptoms, a drop in libido, sexual dysfunction starts to happen. They may notice that they are losing some body hair, their muscle mass, they are losing muscle mass, they are not as strong as before. They can train very hard, but somehow the muscles are just not responding and not building up, and not getting stronger. They may be find that they are putting on weight, right, because of a low testosterone. And sometimes the mood can be depressed. There can be signs of depression, feeling low, unhappy. And some of the other symptoms that one can experience include maybe a decrease in energy level, feeling tired all the time, and that can affect work. Sometimes when the man has low testosterone, his work gets affected because he finds his memory is getting poorer. He can't remember the instructions his supervisor just gave him not too long ago, becomes forgetful, and he may find it difficult to focus at work. And in the afternoon, after he keeps falling asleep, he can't really focus on his work. So when these problems start to occur, do think about the possibility of having low testosterone. Now, a blood test will be useful in identifying the low testosterone. And indeed, if it's there, then there's an option of testosterone replacement therapy with medication. Now, the other thing I want to talk about is the penis, right? So, the penile cancer is not common, it's rare, but it does happen in men who are older, usually 60 years and above. Happens more in men who have a foreskin, right, uncircumcised. Happens more often in men whereby the foreskin is very tight. They have very tight foreskin. They can't really pull it back to clean the inner part of the penis, and this has been there since young, all right, and or maybe develop later as they get infections. So when the foreskin cannot get retracted, a lot of dirt start to accumulate. Dried secretions, dead cells, like what we call smegma, start to accumulate around the penis, and over years they start to affect the cells of the penis and start to develop cancer. Right? So with these foreskin issues, there can be recurrent infections. All right. Now the cancer of the penis usually present with a lump or a mass. Sometimes it can be an ulcer. It may not be painful. In fact, most of the time it is painless. All right. Sometimes they can bleed, sometimes they don't, right? But these are something to be aware of. They are also associated with what we call the HPV, the human papilloma virus exposure. So, as I mentioned, tight foreskin, phimosis, poor hygiene is one of the risk factors for developing cancer of the penis. And as you can see, the level of phimosis really varies, right? In a normal situation, it's easy to pull the foreskin back, clean it, right? But it can be so tight that it is almost impossible to pull it back. Or during sexual activity, if you forcibly pull it back, you get a tear, you start to bleed, it gets very painful. So this is a problem of the foreskin that can happen. Now, when that happens, usually the solution in the type 4 skin is a straightforward procedure called circumcision. Very common. There are some, in Singapore, there are some religions like the Muslims or the Jewish. It's common to have a circumcision as part of the rite of passage, right? It can be done, most of the time we do it under general anesthesia with maybe or injection to the penis to numb it. And then we remove the skin and then stitch the edges together. Recently, or rather just last week, we have in the National University Hospital, we started doing this what we call shank ring circumcision. We feel that it is useful because patients who go for circumcision using this method do not need general anesthesia. They do not need any injections. What they need is basically application of a topical anesthetic, basically a numbing cream over the penis, numb the skin, numb the penis, and then after that, the shank ring is applied and the skin removed. And this device prevents bleeding. All right, so it helps in reducing bleeding, and there's no need for suture, making it quite fast procedure that can be done with the patient fully awake and comfortable. Now, the other condition I want to talk about is deformity of the penis or Peyronie's disease that happens also in men and also men who are older. This presents usually as a finding of abnormal curve in the penis, especially when they are having an erection. There can be a few phases of it. The first phase, there may be pain. It can last for 6 months, and then the pain goes away, and the curve starts to be observed, and it gets worse over time. Patients who have this condition, Peyronie's disease, may have difficulty having intercourse, simply because the penis is crooked. It's very hard to have penetration without causing pain to either themselves or their partner. And when they actually check the penis, sometimes they can feel a hard lump. Right? This is one of the reasons that can bring a patient forward to look for help, because the hard lump can either be a plaque or it can be cancer. So we need to find out what's happening. There's treatment for this, which includes medication as well as surgery. Now, I want to spend some time to talk about erectile dysfunction, because erectile dysfunction is not only relevant in just because men get older, but also men who seek treatment for prostate cancer, right? Be it surgery, robotic surgery, be it radiotherapy. Quite a substantial proportion of men subsequently find that their erections are not very good. All right, up to a 20% lifetime chance for a man of getting erectile dysfunction, and it is described simply as the inability to get an erection, to maintain an erection that is hard enough for them to have a satisfactory sexual intercourse. And this is something that's persistent, keeps happening, right? So this is the definition of erectile dysfunction. And there's different degrees of erectile hardness, right? Sometimes the erection the man is very aroused, but the penis gets a bit bigger, but it's not really hard. Or it can just feel a bit firm, like maybe a banana without the skin. In a full normal erection, it should be very hard, like cucumber. That's why there's an erection hardness score that we use visual cues to help men identify, is it possible that I may be suffering from erectile dysfunction? So how to get a good erection? Good erection needs good blood flow to the penis. It needs good blood supply to the penis, right? When the man is aroused, the blood flows to the penis, causing it to get engorged, get enlarged, get hard. That's how a good erection happens, right? When the man gets older, sometimes the blood flow gets worse, the nerves don't work as well, and when they're aroused, they're not getting the same kind of response. Now, treatment for erectile dysfunction really depends on how severe it is and what's the underlying cause. There's medication that can help, right? We call it PDE5 inhibitors, basically medication that can increase the blood flow to the penis when the person is aroused. There's usually taken, it can be taken maybe about half an hour or 1 hour or 2 hours before intercourse. There's a long-acting form, there's a short-acting form. It can be taken on demand, as I mentioned, just before intercourse or taken on a daily basis in some situations. Very common question I get is, for patients who have erectile dysfunction on medication. First is, doctor, will I get a heart attack from this medication? I think there's a lot of maybe old articles or old concerns about this medication causing heart attack. And the other thing is, will I become addicted? So, to clear the air, these medications do not really cause a heart attack. But a man who has existing heart conditions, they are not well managed. He's getting chest pain when he walks, walks one bus stop. He's getting chest pain when he's climbing up the stairs. He needs to put a tablet under his tongue to relieve the pain. These men are not suitable for treatment with medication, right? Because they got to treat their heart first, right? The next question is, will I become addicted? So some men think that once they're on this medication, there's no turning back. I'll be dependent on it lifelong, forever. There is some truth to that, but it's not the medication that causes a dependence or addiction. It is more because the condition, as we know, decreased blood flow, nerves not working so well as one ages. These conditions actually progress when you get older and older. So how is this? These conditions are usually not reversible with medication, which is why over time the man may find that, once I reach the stage where I need to be on medication in order to get a heart erection, I probably need this on a long-term basis because this condition doesn't reverse. When medications don't work, all right, there are stronger ways to help get an erection through the use of self-injections, medications that are injected into the penis. The needle is a little bit like the insulin needle. The usage is on demand. So when the man wants to have intercourse, medications don't work anymore. Medications have failed. What he can do is to put the medication into his penis by self-injection and then get a better erection. There's other treatment modalities like what we call low-intensity shockwave therapy, whereby repeated exposure of the penis to a low-intensity shockwave, all right, can stimulate some changes hormonally and then lead to the development of new blood vessels. We call it a low-intensity shockwave therapy to treat erectile dysfunction. And then there are also mechanical devices, external devices, all right, that is used to bring blood to the penis mechanically using a vacuum erection device. And after the penis is hard, quickly put on a constriction band to keep the blood there. Important is that after intercourse, remove the constriction band so that the oxygenation of the penis is restored. Now, there are surgical ways to treat very, very severe erectile dysfunction as has failed all other treatment, and that's the use of penile implants. On the left, you can see the malleable type, which is basically just a semi-rigid rod that's implanted into the penis. On the right-hand side is the inflatable type, whereby it's a hydraulic system used to run the implant, so that when the man wants to have intercourse, he can get himself ready, get an erection, and after the intercourse, he can put the penis back to its original shape and position. So this form of treatment is useful. The man will still get a normal sexual sensation, orgasm, ejaculation if he still has. So by sharing all these, I hope that a few things to take home with you is, number one, understand that man is unique. Remember the 3 organs that we need to pay attention to. Prostate, yes, there's examination for it. Testes and penis. When you go for a regular health screening, the doctor looking after you may not always check the testes or check the penis. All right, so this is something that the individual has to take charge as a man and examine on a regular basis by self-examination to pick up anything that's abnormal. And if you do detect anything that's not quite right, do seek help from your doctor. Right? So, okay. So with that, I end. Thank you.
Thank you, Dr. Joe. Okay, so next up, we will move on to an interesting conversation with the chairperson of SCS's Walnut Warriors Prostate Cancer Support Group, who is a cancer warrior like myself. For those of you who might not know, I actually was diagnosed with testicular cancer last year, so this is quite an interesting experience for me, I guess. And without further ado, let's welcome Mr. Sam Ho. Over the years, Sam has actively participated in SCS Walnut Warriors Support Group activities, which has spurred him to attend training and be certified as a SCS patient ambassador so that he can extend help to other newly diagnosed cancer patients. The SCS Walnut Warrior Support Group was founded in 2013 to support men impacted by prostate cancer by providing a platform and safe space for patients to share their personal experiences, exchange information, and gain knowledge on prostate cancer-related topics through regular education and talks. It is a peer-to-peer support platform that builds camaraderie and a sense of community among patients. Hi, Sam.
Hi. Hi. Good morning, everyone. My name is Sam. I'm age 64, newly retired this year. When I had my prostate cancer diagnosed, it was almost 7 years ago. So I got diagnosed for prostate cancer quite early at age around 57. How did I got myself into that situation? Really, I think men cannot run away from plumbing problem after you grow older. So at one of the polyclinic, I decided to maybe get myself referred to see a urologist and maybe just do a check on my urinary system. So lo and behold, the first thing the doctor did was say, okay, lie down on the couch and let me do a digital examination. And straight away, he found out that I have an enlarged prostate. And I think together with some blood tests, I think further investigation is needed. Yeah, so that was the start of it all.
Okay, so actually prior to your diagnosis, right, were you aware that prostate cancer is very common in Singapore, and do you know the signs and symptoms?
I think like what we saw in the video, first thing is prostate is similar. You know, many of us don't even know that, that we have such a walnut-looking like organ. We only know the other two, which is the like what the doctor say, penis and the testis. You know, so because what we call the prostate is embedded inside, just below the bladder, so we don't even know it's there, and probably not aware of its function because I'm not a science student, so to speak. Yeah.
So okay, so after getting diagnosed, right, the next step for you was to undergo treatment, correct? Maybe you can share with us like how the treatment was for you, because I think for myself, I went through chemo and also the orchiectomy, the one I took out my right testicle. So I think for me that was very scary. But how was it for you?
I think we go through 3 phases, I call it. First, the panic phase. When the doctor tell you, I'm sorry to inform you, Mr. Ho, you have cancer. I think that word stun you, and you fall into a state of panic. Then slowly, you start to realize that you have to go into the patient stage. Yeah? You have to really listen to the doctor. But before you go into the patient stage, the first thing, what do we do nowadays? Go and Google. But the more you read, the more scary you become. You get worried about what will happen if you do this treatment, do that treatment. And internet, earlier on, 7 years ago, not like now got ChatGPT, you know. So you only hear all the scary story from America when you Google. Yeah? But today, if you Google cancer, Singapore, or Singapore cancer, the first thing you see on top of the list is Singapore Cancer Society. So I think the biggest thing that Singapore Cancer Society has really done for cancer patients in Singapore is really to promote public awareness. And I myself, you know, when I Google also, and I stumble into Singapore Cancer Society webpage, I realized that there is this group called the Walnut Warriors. And of course, like what Dr. Daniel shared, Sister Sarah was my guardian angel when I was diagnosed at Tan Tock Sek Hospital. You know, she spent a good almost half an hour assuring me that it's not as scary, you know, there is a good prognosis. If in a tongue-in-cheek way, if you have to get cancer, prostate cancer is one of the best. because, you know, you can get it treated, you have a good progress, yeah.
Actually, when I was diagnosed also with testicular cancer, I was also talking to somebody lah, and then they were saying like, technically, testicular cancer is one of the best ones to have, you know, if you have to have, right? Because it's in the outside of your body, so it's easier to, you know, take out, and it's not, I wouldn't say invasive to the whole self, right? So I think we are both lucky lah.
Yes. I think the lucky part is that I was diagnosed early as stage 2, meaning to say my indication is that it's still localized. So I was, of course, after you get to the panic stage, then you want to quickly take the first treatment option. Kanchong already. So I was kind of given an option to do a surgery, and maybe in those days, 7 years ago, can cut. Cut means can cure. Then quickly, quickly arrange and quickly cut. Yeah. So, but I think the thing is that I had also wanted to hope to speak with some patients who have gone through. So when I stumbled upon Cancer Society website, I also indicated to them that I would like to speak to a survivor. Although having spoken with Nurse Sarah, I was already pretty comfortable. But maybe at that point in time, there were not so many active Walnut Warrior members able to support. But after I went through my surgery, I told myself, actually it's a very meaningful thing to be able to be an active Walnut Warrior, because I think prostate cancer can present itself, just now doctors have already shared, from stage 1 to stage 4. Different people will have different need for different information. I go to surgery, I cannot share my experience with someone who go for stage 4 metastatic kind of a treatment. So I think this is what I have benefited a lot in my several years with Walnut Warriors.
Okay. Just now, a lot of the doctors mentioned that, you know, we as Asian men, we try to portray this whole like, we must be strong for our family, for everybody, right? Did you have any like biggest worry throughout the treatment?
I think upon first diagnosis, your first important person is your wife. But your wife, unfortunately, is a woman. You don't understand, or may not understand as much as what you will go through and have to go through. So certainly, if you can find another man to talk and listen to, it might be better. All right? And I think after I got myself trained as a patient ambassador, I can see that my sharing with them has helped them calm their panic. All right? Because, you know, it's about living with cancer. And especially prostate cancer, there is a lot of good living left. Many, many more good years. All right? So, there are lots of treatment options. And the thing is that doesn't mean you finish one treatment happily ever after. Some is, they are told, active surveillance. But survey, one fine day may have to take action. Then some, maybe in their stage 3, you know, gone for radiation, but the cancer may come back. So it's good that we can have a group of people like this, come together, invite doctors to talk to us, you know, drink kopi together, go and exercise together, strengthen yourself, improve your diet, improve your psychosocial, so that you have more information, more knowledge, and you can have some resources to refer to if the condition come back and haunt you again.
Okay, thank you. So I was wondering also, because you talk about the support from outside, how was the support within your family and friends? How did they react to your diagnosis?
I guess family is the most important part. You know, they have to understand that you may have mood swing or whatsoever, you lost your libido, you may, you know, have hot flushes for those who go for hormone treatment. So that's their first line of understanding. And of course, for myself, my treatment is surgery. So immediately after surgery, there's a lot of other issues like incontinence, like, you know, pain here, pain there. And then, of course, you will improve over time. Yeah, so it has been 7 years since. I think it's important that as a cancer survivor, as part of a support group, we can look forward at some of the other seniors or who has traveled past the path you have, you know, for them for advice or for understanding. And if we can, also can help those behind us, you know, this might what be akan datang. This might what be something that you need to consider. So eat well, exercise, find meaning in life, keep a healthy spirit.
Okay, thank you, Mr. Sam. So the SCS Walnut Warriors, right? How did you actually join? And how can the audience, you know, join?
Okay, of course, once you are diagnosed, get treatment. Of course, you can go direct to Cancer Society and register and indicate your interest. But through the other hospitals, there are the specialist nurse that has been trained. They will also can help to refer you to this support group so that you can, you know, get information, have a listening ear, and then listen from a patient's perspective of what you are going to go through. All right? Yeah. So I think really it's about you have to support yourself. If you are a patient, you have to support the Walnut Warriors. I think Walnut Warriors and as well as many others, we support SCS because they really have been doing a marvelous job to help cancer patients in Singapore. Yeah.
So you were part of the Walnut Warriors, right? What made you become chairman, like the biggest Walnut Warrior?
I guess we are a bunch of quite old people, you know. I'm relatively younger. The founding chairperson is already going to celebrate 81 years old birthday next week. Yeah? And then the second chairperson is already 70 odd. So they look at me, you so regular attendance, you quite active, you can volunteer as a patient ambassador, come. Join the committee first. Then slowly, I think important thing is I myself find that it's a meaningful piece of work. And of course, I get lots of support from the Cancer Society, the team, you know, to organize the activity. I only come and say a few words, lim kopi with them, and then encourage them a little bit here and there. So I think as a community, we ought to help ourselves because it's not the end, like what I said earlier. You know, for many patients, there will be chapter 2, chapter 3 down the road.
So in terms of volunteering, because you volunteer a lot of your time, what is your motivation for volunteering in SCS and also in like being a Walnut Warrior?
I mean, as someone who has kind of gone through the prostate cancer survivorship, I felt that especially for those who choose to go for surgery, my experience going through the surgery will be very helpful to them, you know, what must they prepare before, during, after, and it gives them a lot of reassurance. I feel good doing this sharing with them. And for those that I cannot help much because they have opted for different treatment options, like they go for radiation, they go for hormone therapy, then of course within the group of Walnut Warrior, we will have people with the kind of experiences, connect them, get them connected, and they have their conversation, they have their coffee session, they have their own additional CCA outside of the regular meetings. Yeah.
Okay, I would like to retweet that. I don't know if you guys know this, but I am active on social media, and I do share the same sentiments, like sharing about your journey, and it really helps with people who are undergoing similar treatments as well. So that's pretty cool. Okay, so now to end off, maybe you can share a word of encouragement to the fellow men out there who might be struggling to accept their diagnosis.
I think first of all, like what the good doctors suggest, I think with the new capability, technology in cancer screening and the willingness of you to come forward to get checked, because if you detect it early, like for me, I think technically I can call myself a cured case. I survived 6-7 years, and so far I just need to go back annually for medical checkup. All right. So the important thing is that cancer is not a death sentence. You don't have to walk alone. You don't have to face it alone. You don't have to panic, because there are others along the same journey. They will be able to kind of share their experiences with you. And really, prostate cancer, being a man cancer, is really not as frightening, even like what mentioned by Dr. Raj. Even at stage 4, there are new and newer drugs that will be put on trial and then put into the cancer drug list. Then you can, still have a lot of good, healthy living ahead of you. Go for your exercise, go for your buffet, just don't eat too much meat, okay, and eat the right kind of food. So really continue to focus on living with your condition. Yeah?
All right, thank you so much, Mr. Sam.
Thank you everyone for your kind attention. Thank you.
Now may we invite Ms. Vijaya Lakshmi Chadachan, Senior Physiotherapist at SCS Cancer Rehabilitation Center, to give us insights into how you can maximize physical health through rehabilitation. With over 16 years of experience in both acute and community settings, she's a strong advocate for cancer rehabilitation throughout the entire spectrum of cancer care.
Thank
Ms.
you,
Vijaya,
Rana.
please.
Thank you. Hi. It's an honor to be here today, and I'm really happy to look at such a big turnout, and I'm very happy to see a lot of ladies around to see that they are here to support their partners, and it's really heartening. Yeah, so here I'm talking about what is the role of rehabilitation in prostate cancer. Actually, whenever I talk to my friends or anyone and I tell them that I work with Singapore Cancer Society and we have a cancer rehabilitation center, the first thing they look at me and say, "Cancer still need rehab, meh?" Unfortunately, it's still, there's not much awareness, but rehabilitation has a major role to play in not just prostate cancer, but every single kind of cancer. So I'm just going to talk about specifically today in rehabilitation of prostate cancer, what are the things that where rehabilitation or a physiotherapist or exercise, what kind of role we play in your recovery and to improve the quality of life per se. Yeah. So these are the things that I'm going to be talking about today specifically. So as I think it's been mentioned many, many times, the prostate cancer is the most common cancer in Singapore right now, but it's also the most curable cancer to have, actually. Yeah, so it's usually diagnosed, as most of the doctors have already talked about this, so I'm just going to skip this. And these are the treatment options, which have also been explained in detail so far. And these are the various treatment options that are there, surgical as well as non-surgical. So where the role of rehabilitation comes is usually what are the treatment-related sequelae that you may have. And so obviously, one thing is to cure the cancer, and the other thing is to deal with what comes after that. Yeah, and so these are some of the side effects, possible side effects that you may actually face because of the various treatment modalities. Because surgery sometimes involves removal of prostate gland, and which can injure some of the nerves. So there are certain pelvic issues such as urinary incontinence, erectile dysfunction, infertility. The hormone treatment, as they mentioned, testosterone is needed for the muscles, bone health in men, and when the lack of testosterone can actually lead to bone health issues like loss of bone health, putting on weight, reduction in the muscle mass. So you need something to counteract those things. Even with the radiation, they can cause long-term pelvic health issues in certain group patients. So these are some of the things we are going to talk about and explore what are the options that you have in terms of management of these things. So as I just mentioned earlier, so the sequelae could be because of multifactorial, so it could be because of the surgery, radiation, hormone therapy, and we also need to take into consideration whether there are other non-cancer related health issues that you may have, which also will influence the side effects that you may be facing after the treatment. Yeah. The most important ones that I mentioned, there will be some musculoskeletal sequelae and also some pelvic floor dysfunction, such as bladder or bowel incontinence and sexual dysfunction. So these are certain challenges that we realize that some of our patients with prostate cancer actually face. There's fatigue because of the treatment and in general deconditioning, you feel a bit weaker, you don't feel so good, then the bone mineral density is reduced, there could be your bowel and bladder function may be affected in short term or long term. Yeah. Then, of course, sexual dysfunctions. There might be some sleep issues because of certain, it could be because of the treatment-related anxiety or actually some chemotherapy or radiation-related side effects. Weight gain, usually that happens because of the hormone therapy. Then some patients do affect, especially the elderly, if you have other comorbidities, then you may affect certain mobility and functional issues. All these can affect your return to work, ability to go to work. Imagine if you have incontinence and you're constantly running to the toilet or you're always worried whether I'm going to leak. So sometimes that prevents men to, first of all, talk about it, get help about it, and it might affect their work ability to gain employment and sustain the employment, in a meaningful way. That adds to financial stress, family issues, because sexual dysfunction can be a big thing, and it does affect family and social and psychosocial well-being of a person. So even though we say yes, it is one of the most curable cancers, but it can be quite devastating. If the side effects are severe enough, it can majorly disrupt a person's quality of life. So why rehabilitation? As I said, a lot of times people's idea of rehabilitation is, okay, you got back pain, you go see a physio, you got a stroke, so there's a rehabilitation, or if you have a very visible disability, then you do rehabilitation, but that's not always the situation. In cancer, when we talk about rehabilitation, so there are various objectives at various stages. And when is a good time to start a rehabilitation? Actually, rehabilitation or exercise is advocated in the cancer spectrum, right from the point of diagnosis all the way to the advanced stage, or even in the palliative situation, is indicated throughout the spectrum of the cancer. But there are various goals at different stages. So prehabilitation is usually defined as the rehabilitation that actually takes place before the active treatment. That means maybe before the surgery, before the radiation. That's the time from the diagnosis, between the diagnosis to the active medical treatment. That's when you have any intervention, that is what we call prehabilitation. And the goal here is to optimize body's function so that when you get into the cancer treatment, you are in a better state to tolerate the treatment. So you maximize. So when you are starting off with a higher reserve, the cancer treatment itself is going to cause some amount of, whether it's surgery or whether it's radiotherapy or chemotherapy or whatever, it is going to cause some amount of decline in your physical state and function. But if you start off at a higher state, obviously the decline is going to be minimal. So that is what we are aiming for with prehabilitation. At the same time, in the context of prostate cancer, the evidence is very strong to show that if you start pelvic floor rehabilitation, pelvic floor exercises before the surgery, obviously when you start off with stronger muscles, a better well-coordinated set of pelvic floor muscles, after surgery, the recovery is much better. Yeah, so that is where prehabilitation comes in prostate cancer patients. Then, is it safe to do rehabilitation or exercises as you're going through the cancer treatment? Yes, it is. And actually, it has shown that, especially patients who are undergoing chemotherapy or radiotherapy, in this group of patients, it has shown that actually they are in a better position to tolerate the side effects of the cancer treatment itself if they are going through some supervised conditioning and training exercises as such. So that is during the treatment. Of course, after the cancer rehabilitation, actually in this day and age, it's very hard to kind of imagine somebody getting a simple surgery like a knee replacement and all, and being sent home without any rehabilitation. Yet, we see cancer patients where they go through this multiple set of insults to their body with surgery or the radiation or the chemo, where the multiple systems of your body is affected. The treatment that can last months and months, are told, you know what, you're cured, go back to your normal life. That usually doesn't happen. Sometimes the patient, usually people who have had treatment, they may face, there are many, I kid you not, there are many of the people who actually will do very well. Even like, once all the medical surgical treatment is over, they're fine, but there are many of them who actually struggle to get back to their routine, get back to their life, because they face a lot of short-term or long-term treatment-related side effects. Yeah, this could include things like bone health, joint pains, fatigues. In prostate cancer, again, you may have deconditioning, fatigue, memory loss, you're unable to concentrate, you're unable to sleep well, you're, sometimes if you have had pelvic lymph nodes removed, you may have swelling of the legs, or as I mentioned, again, bowel and bladder incontinence or sexual health function, which can be quite devastating. So all these need to be addressed, of course, physical as well as psychological health issues. Yeah, and what rehabilitation aims to do is we act as guides so that you can take charge of your health in long term, because as Mr. Ho just mentioned, Mr. Sam, that there are years and years of life ahead of you. So it's important that you take control of your own health. It's important to have not just live, but live well. And that's where rehabilitation comes into picture. So why exercise? Why do we, I think, I'm going to say it, but it's a cliche that exercise is medicine. Yes, but it is very true. And in cancer patients, especially in prostate cancer patients, we all know what benefit it has, like increase the muscle strength, increase the energy, decrease the side effects such as fatigue, improve your bone density, increase your cardiovascular fitness and respiratory function. I think we all know that the survival rate in prostate cancer patients when detected early is very high. So most prostate cancer patients actually, if you look at why they die non-cancer related causes such as heart disease and all, and you tend to put on weight. So your overall cardiovascular and respiratory function goes down with hormone therapy and aging as well. So all these side effects can be mitigated with exercise. But can I just have a show of hand? How many of you all exercise regularly? Not bad, but it's still about 25% of the crowd so far. Yeah. So yes, get active. No matter where you are, start there. Yeah. Later, my colleague Michelle will guide you through an exercise program, routine. Yeah. So what are the recommendations? Yeah, one thing is like, yes, Vijaya, you say exercise, but how? What are the guidelines? What is important? What is a correct way to exercise, Yeah, so the general guidelines are, a good exercise program should have 3 components. Aerobic, which is your walking, jogging, cycling, swimming. These are the exercises which actually increase your heart rate, classified as aerobic exercises. And what is recommended is about 30 minutes of aerobic exercises about 5 times a week at moderate intensity. And what moderate intensity means is when you're exercising, when you're doing that activity, you should be able to talk in short sentences. So if you are able to sing while walking in the park, you're strolling, you're not exercising. At the same time, if you have to stop in between to kind of catch your breath to complete a sentence, that means it's a bit too high, the intensity. You've got to back off a little bit. Yeah, and this you need to do about 30 minutes, 5 times a day. But the good thing is you don't have to get all these 30 minutes like, in one go. You can actually divide it into 3 times. So like simple things like, get off the bus stop, 2 bus stops, before, like get a 10-minute walk, like before work or after work, or like, taking the staircase at work. All these things actually add up. So it's actually it's actually possible to incorporate exercise into your daily routine. But that's just not enough. The other thing you need is resistance training, especially for men who are on hormone therapy for prostate cancer, because you tend to lose muscle mass. So strength training is very, very important to mitigate that. The good thing about strength training is you don't need to do it every day. You only need to do it 2 to 3 times a week. And you can use free weights, you can use body weights, you can use TheraBand. So later you can have some examples of certain exercises my colleague Michelle will teach you. Yeah. And it's also important to maintain your flexibility. So some of the stretches that you do after your exercise program, because if you're less flexible, you're more likely to get injured. So flexibility training is also very important. You don't need to do stretches 10 times. You just do 1 or 2 good stretches with a 30-second hold. You're good to go. Yeah. What about in advanced cancer? Is it safe to do exercises? Yes, a safe and effective, it's shown to be safe and effective to do exercises in advanced prostate cancers as well, even with those who have had bone metastasis. But the key here is it should always be supervised, individualized, get a professional to design an exercise program that is specifically for you. So this is where probably, somebody who has worked with cancer patients, somebody who has knowledge in that area is something that you need. Yeah, and it's been shown to actually slow disease progression, maintain your function, and improve the overall quality of life. Yeah. Okay, I'm going to talk about a little bit about pelvic health challenges which are faced by patients who have had treatment for prostate cancer. So usually, even though nowadays we are very advanced in terms of the kind of surgery that is performed, and as mentioned, they usually do a lot of robotic assisted surgery where, like, they try to preserve all the nerves around the prostate. But of course, nerves being nerves, sometimes they don't like the fact that they've been disturbed. Even though they've been preserved, sometimes they just go on a strike and they don't function very well. And one of the things that happens if you have prostate removed is the part of the mechanism to control the urinary flow, one of the internal urinary sphincter is removed. So you have a team A and team B, which is your external sphincter. External sphincter is still there, but you have part of the gang which is missing. So usually some patients do have some amount of difficulty with continence, urinary incontinence in surgical patients. As well as why fecal incontinence? So sometimes actually with patients who have had radiation, over a period of time, the sensations in the rectum may change, the quality of the tissue may change, and that may eventually, over a period of time, you may see leakage of the fecal content, or you do not feel the sensation of, the rectum being full, and that may lead to accidents and things like that. So that may happen in certain patients. And of course, erectile dysfunction is a big thing that may actually happen in a lot of patients who have undergone surgery and radiation. And the loss of libido might also play a part in patients who are on hormone therapy with low level of testosterone. So just like how the cancer treatment itself is not one size fits all, The rehabilitation in pelvic health management is also not one size fits all. So it really depends. We need to assess, like, you know, what is the kind of treatment that you have had, what are the kind of symptoms that you're having, and then we kind of have to plan a treatment or pelvic rehabilitation program that is appropriate for you. So, but some of the things actually, I wish it was as simple as, okay, do the pelvic floor contractions, do this. I'm sure, like, you know, some of you've been taught, like, you know, okay, just contract, you know, like your muscles and just hold for 5 seconds and let's go. But it's not as simple as that, because you need a lot of, it's not just the strength of the muscle which is important, but also the pattern of recruitment, like, you know, a coordinated activity of these pelvic floor muscles is important to have a good continence and erectile function. And that's why it needs a little bit more tailored approach, differs from person to person. And for patients who have had radiation, usually they have issues where they have urgency continence. So they may have a good sphincter control, they may be able to hold, but they also, like, you know, they feel like they have to go to or toilet very often. And sometimes when that sensation comes, it actually is very fast. It's actually because it's not so much of a sphincter issue, but the bladder itself has become overactive. So even when it's not full, like, you start to feel urgency. So in this group of patients, what we need to do is more of like a bladder training. So the physiotherapist or the pelvic health rehabilitation expert will guide you through how to train your bladder so that you can actually manage your habits better, the lifestyle changes which are required, like certain food you need to avoid, certain drinks you need to avoid, and also like how to keep a bladder diary and how to like slowly, gradually increase the capacity of the time that you can hold the urine so that you can actually gain a better control of your continence. Yeah. Fecal continence, again, something similar. So we need to kind of work very closely, like you know, what are the issues that you're having. It's not just a pelvic training, a pelvic floor muscle training. Also for fecal incontinence, it's a different, like, you know, we want to have more posterior group of muscle, which we need to strengthen compared to anterior group of muscles. And it's also always good to have a dietitian on board so that they can do some fiber manipulation. Whereas, it's not like whether you have more or less. It depends on your stool chart, like, you know, so they will go through all that and like kind of get the fiber manipulation and get your continence under control. Yeah. Sexual dysfunction management, again, it can be because of the hypoactive or hyperactive pelvic floor muscles, and a thorough assessment is required. It's not like we just doing the pelvic floor contraction is going to answer all your questions. I wish that was the case, but sometimes when the muscles are hyperactive, that can also cause difficulties. So you really need an expert to actually look into it. Sometimes they may have to perform an internal exam to assess, and then see what is needed specifically for you. And it's also a multimodal intervention, which may involve some pharmacological intervention as well, as Dr. mentioned earlier. And of course, you need to involve, you may need, this is something that is very personal, very intimate, and this can actually have family implications and psychosocial implications. So it's always good to have a psychologist or to kind of be on board to give you the emotional support that you need. Yeah. So with all this, now I'm just going to talk briefly about some of where SCS rehabilitation programs comes into play. So we have these various programs under our umbrella. So we are very proud. I'm very proud to say this, but Singapore Cancer Society's rehabilitation program is very unique in the sense that we are the only ones that we know of, at least I know of, in Singapore, which provides one-stop cancer rehabilitation in the community. I don't know, and that's all we do. We do only cancer rehabilitation. We don't do anything else. So we have multidisciplinary team which consists of rehab physicians, physiotherapists, occupational therapists, speech therapists, dietitians, cancer exercise trainers. Along with that, under our psychosocial services umbrella, we have social workers, counselors, art therapists, sexologists, welfare and support groups. As Mr. Sam Ho mentioned, he's a proud chairman of our Walnut Warrior groups. Yes, a big shout out to them actually. They are doing a wonderful job. Yeah. And also we have home hospice services, which is mainly meant for patients who are under palliative care, end-of-life care. We have doctors, nurses, and we are the only hospice services which actually has the allied health professionals on board. What that means is whatever the list you see on this side, the entire suite of people supports even the hospice team. And this is very unique, actually, in Singapore. We are located in National Cancer Center, as well as we have one more branch at Jurong Medical Center. So this is how you can actually take a picture of this slide. This is a QR code for referral. Just if you want to have, you can just walk in and drop, express your interest, or you can take this fill up this referral form and email to this address if you want to be referred to rehabilitation services. That's all for me. I think. Thank you so much for your time and attention.
Thank you, Ms. Vijaya. All right, just now I actually noticed people taking photos of the recommended exercise. So speaking of exercise, we'll be doing the resistance band exercise, and meanwhile, the SCS team is going to distribute the resistance bands. Please note that these bands will be prioritized to those who are wearing proper footwear, so those wearing shoes and everything. And for those of you who do not wish to join the exercise, you can head down to the booths where you can ask the doctors your burning questions.
Hello, everyone. I'm Michelle, cancer exercise trainer from Singapore Cancer Society. So now we'll be starting our exercise session. So let's welcome Rusty, our volunteer, and also Mr. Chew. So they'll be together on stage with us to perform the exercises. So before we start, make sure that you are feeling well enough to join us, and make sure that you are wearing a proper footwear before you start. Okay. And also, for those during the exercise, right, if you are not feeling well, feel free to stop and take a seat. Okay, so before I start, maybe let me talk a little bit more about the resistance band first. So for this resistance band, the proper way to hold it is to wrap it around your palm. Don't wrap it around your fingers, it will be very painful for you. So let me show you. So this is how you should hold it during the exercise, okay, with both hands. Yes, correct. And after you hold it with both of your hands, what you want to do next is to test the resistance. So try to pull apart. Feel the resistance if it's comfortable enough for you. You should feel a little bit of resistance there, but you should be able to do the full movement, okay? Okay, so our exercise, we will have 3 phases. So the first one is the warm-up, and the next one is our resistance band exercise, and the last part is our cool-down exercise. So during the exercise, I'll be having to hold a mic. I have to count while you exercise, so I will not be able to do the complete set of exercises. So you may refer to Chew or Rusty during the exercise as well. Okay, ready? So for the warm-up, we don't need to hold on to the resistance band first. Warm-up and cool-down, you don't need to use this. So you can, yes, correct. Just wrap it. Yeah. Okay. So the first warm-up exercise, music? Yes. Okay, our first warm-up exercise, marching in place. Are you ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 3,
40,
2,
50, 60,
1.
70, 80, 85,
So that's the end of our warm-up. So now we are going to
I open my eyes and everything's still the same. I jumped to the guy who stayed last night and asked him what's your name. Seems to happen more and more. I love this man more than before. If you know what I mean, makes my heart beat fast when I see them so strong and tall. So little time, how can I lose? So little time.
Okay, very good. So, up,
Tell me,
and you are going
to
to
the
go in the
world,
part,
I should
and the
just
band
settle
is supposed
down.
to be behind your
I don't wanna stay
when
with
you do
just
so.
one man. I wanna settle what's around.
Over your muscles
It's like heaven every night. Being here with someone new.
We are going to do some
Physical feel, beautiful
Are you ready?
Let's
go. Very good. One more set.
60,
Go.
60, 65, 70, 75, 80, 85, 90, 95. So really, who cares about love? Who wants to feel taken away? 52 weeks, every year there's a new one every day. It's too hard to choose, to make up my mind. So many things to turn on my lights. Don't want your love, don't want friends, just give me the lights tonight.
We
on the telephone. All the Zoom angels disguise the light. Everything that happened till the morning light. For your right side. Ready? Go. One. And open up. Sideways. And two. Come back. Open up. Come back. Three. Open. Mysterious life. Come back. Moving around, dancing the rhythm of life. Time. If this is too high, you can adjust. Mysterious time. It's not strenuous for you when you are going to open your hands. Hours and days to the end of all time. And we're feeling it changing, we don't know why. Choose one direction, just one for a time. Don't say I'm thinking too much if you see what's behind. And these are mysterious times. Last one. And mysterious. Very good. Now change to your left side. No trick of the mind. So this moment I feel like we're living mysterious times. Let's go. Go. One. See what's behind. are the same as me. You breathe the air I breathe, and we don't understand. Yeah, we don't understand. And if you don't ask questions, you won't know why. So say your prayer for the time while there's still time.
4, 5.
Pray for the good and pray for love. Pray for peace and pray it's enough. Pray for salvation. Pray that we're right. Pray one day we open our eyes and pray for them and pray for us. Pray one day we can live as one. Pray for the children 'cause time is to come. And pray and forgive us for the stupid things we've done. We all see the same sun. It's day a golden praise His song to the wonder of man. Yeah, the wonder of man. And when we look, what can we see? All the riches that are free. No, we don't understand. Yeah, we don't understand. And if you don't ask questions, you won't know why. So say your prayer for the time while there's still time.
4, 5.
Pray for the good and pray for love. Pray for peace and pray it's enough. Pray for salvation. Pray that we're right. Pray one day we'll open our eyes and pray for them and pray for us. Pray one day we can live as one. Pray for the children 'cause time is to come. And pray that forgive us for the stupid things we've done. Pray for the good and pray for love. Pray for peace and pray it's enough. Pray for salvation. Pray that we're right. Pray one day we'll open our eyes and pray for them and pray for us. Pray one day we can live as one. Pray for the children 'cause time is to come. And pray that forgive us for the stupid things we've done.
8, 9, 10, and 10. Man, very good. Next, single knee drive, where you are going to assume the same lunge position again, like that. So one knee at the front is bent, and the other leg at the back, yeah, correct. So the other leg at the back should be extended. So what you do is
Well, I tried to make it Sunday, but I got so damn depressed.
correct.
Then I set my sights on Monday, and I got myself undressed. I am ready for the altar, but I do agree this time. When a woman sure can be a friend of mine. Well, I keep on thinking about you, Sister Golden Hair Surprise. And I just can't live without you. I just can't get you out of my head. Oh, your loving is all I think about. I just can't get you out of my head. Oh, it's more than I dare to think about.
That your toes, right, is pointing straight, not slanted this way. So make sure your toes are pointing straight, and what you're going to do is that you're going to step on your toes and raise your feet up as high as you can. You should feel your calf muscles working. And
let me hold your body tight. Let's do it right. I live my life. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. I live my life. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. I live my life. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. 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 Let's do it right.
When you're looking at very good. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. I live my life. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. I live my life. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. I live my life. It's a crazy, crazy night. Let me hold your body tight. Let's do it right. Let's do it right. Let's do it right.
Thank you, Miss Michelle, Mr. Rusty, and Mr. Chu for the workout. Actually, fun fact, Mr. Rusty actually turned 70 yesterday. So, as part of celebrating his birthday, he will be organizing a fundraising campaign from now till 31st January 2024 to help SCS continue their work in ensuring that no one fights cancer alone. You can find out more about Mr. Wee and his efforts on SCS Facebook page, Instagram, as well as TikTok at SG Cancer Society. With that, we have now come to the end of the session. I hope you guys gain useful insights into topics discussed by our speakers today. We are constantly looking at ways to better serve the community, so please do scan the QR code on the screen to complete your event feedback form over here. Just scan over there. Okay, once again, thank you for taking the time to join us at our Men's Health Fair, jointly organized by Singapore Cancer Society and Tampines West CC, supported by our partners, National Cancer Centre Singapore, National University Cancer Institute Singapore, National University Hospital, Sengkang General Hospital, Society for Men's Health Singapore, Singapore Urological Association, Tan Tock Seng Hospital. Along with our event sponsors, AstraZeneca, Astellas, Bayer, Janssen, as well as our in-kind sponsors, Metro, Monaco, and True Fitness. Also, if you have been given the risk tag during registration for being the first 200 attendees, don't forget to collect your free goodie bag on your way out. Feel free to pick up a copy of the International Prostate Symptom Score Calculator form at the registration counter to identify and assess if you have any urological symptoms that should be highlighted to your doctor for further observations or screening. Do note that the IPSS form provided is not a diagnostic tool, but a guiding questionnaire to identify if you should have further conversations with your urologist or family physician. Regardless of the score, you should always consult the doctor if you have any signs of symptoms that you are worried about. Okay, so for more information on the cancer screening initiatives and subsidies that SCS provides, head down to our booth at level 1 and speak to our friendly staff to find out more. And if you know any cancer patients that would like to learn more about how rehabilitation programs can help improve their quality of life, you can approach the therapist at our rehab booth too. All booth activities will end at 2 p.m., so do stick around for some fun and games, and also prizes. Okay, so today's talk will be posted on SCS YouTube page, as well as, so do check out if you are keen to revisit the information shared by our speakers. Once again, my name is Rainer, and we wish you a great Sunday ahead. Goodbye.